Why is vascular imaging of the prostate for inflammation important? Because it affects about 1/3 of men over the age of 45. This is important because the digital rectal exam shows no findings in low-grade inflammation, and more importantly, since the MRI is now used as the main diagnostic source of prostate cancer, chronic prostatitis may simulate a mass when nothing really exists. In 2017, we now note that diagnosis of prostatitis or recurrent inflammation of the prostate is nonspecific with many modalities such as CT, MRI, PET, but the combination of dynamic contrast ultrasound and dynamic contrast MRI is highly accurate, up to 97%. Remember, this is important because you can't feel it and you can't see it on anything else but the MRI or the Doppler blood flow ultrasound technologies. So we did a 5-year study, many patients with a large follow-up up to 6 months on most people, and we found recurrences did occur. The normal peripheral zone of the prostate, outlined by peripheral zone echoic, which means it's white, and above it in the darker area, you see a white dot, which is the stone, and stones irritate the prostate, often causing recurrent inflammation. So here we have the normal white area turned black, which shows diffuse prostatitis. The black area can be without inflammatory blood vessels, or it can be with increased vascular findings. That is, the arteries and veins are red and blue respectively, and you can see them diffusely increased. The MRI, which is the main imaging tool used for the past 10 years, shows a butterfly and symmetric pattern. Dr. Barents is one of the world's leaders in prostate imaging from the Netherlands and has written many textbooks on the subject. So he agrees that MRI is useful, and here is a typical butterfly or smiley-faced distribution of the inflammation showing up in the reddish orange on this MRI. A blood flow ultrasound Doppler also shows similar findings. Remember, the Doppler takes 1 minute to do, the ultrasound takes 2 minutes, and the MRI takes 1 hour. So once again, we see the tiny white dots throughout the grayish prostate because the areas of inflammation often calcify and turn into stones, which may again lead to more inflammation because they irritate. So for treatment, since antibiotics often fail, on the left we have a large dark area indicated by the oval yellow circle, and after 4 months of antioxidant, non-aggressive, non-antibiotic treatment using a combination of patented antioxidants, we see that the inflammatory focus has dramatically reduced. So the one on the left is the standard ultrasound, and the one on the right with the 4 frames is the 3D Doppler special histogram study.